A small baby's feeding journey. Most small babies lack the stamina and coordination to breastfeed at first. They may appear to feed well, but the intake at the breast is actually very little. Most will need to feed by nasogastric tube or cup and gradually progress to breastfeeding. This video shows how to assist a small baby's transition to breastfeeding. Begin just after birth by deciding which feeding method the baby should start with. Position the baby at the breast. If the baby can suck, swallow, and attach well, he can successfully breastfeed. If he doesn't attach or suck well, but can swallow, start with spoon or cup feeding. If the baby chokes when he tries to swallow, he needs to feed by nasogastric tube. Teach the mother how to express her milk in the first hour after birth. Then, have her feed her baby the rich colostrum. Next, introduce the practice of kangaroo mother care. Let the mother know that continuous skin-to-skin contact will help her baby breastfeed sooner. Show her how to position her baby between her breasts and place the wrap snugly around herself and her baby. Teach the mother to recognize her baby's feeding signals. At first, the baby may only awaken or stir before feedings. As the baby matures, his feeding signals will become more obvious. Have the mother put her baby to her breast, even briefly, when he signals his hunger. Show her how to position her baby securely so that his head and body are supported. Teach her to express drops of milk into her baby's mouth. At first, he may only swallow once or twice and then fall asleep. If he chokes or turns blue, he's not yet ready to breastfeed. After practice time at the breast, have the mother give the baby his full volume of milk by cup or feeding tube. At this stage, he'll receive almost all his milk this way and very little from the breast. By getting his feeding needs met so easily, he'll grow faster. As the baby matures, he'll stay awake longer at the breast and learn to suckle. Suckling helps develop his feeding skills and stimulates the mother's milk production. Once he suckles well, teach the mother how to attach her baby. Have her rub her nipple on his lips and drip milk into his mouth. Be patient. When he opens wide, have her bring him directly onto her breast. Notice the signs of attachment. His mouth is wide open, his chin touches the breast, and his cheeks are rounded. More areola is seen above the baby's mouth than below. His jaw drops as he drinks, and he pauses briefly as he swallows. Now he's learned to coordinate sucking, swallowing, and breathing to breastfeed effectively. Feeding is hard work for a small baby. Watch for signs that the baby has had enough. He may bat at the breast, pull off, cry, or fall asleep. Then let him rest skin to skin between the mother's breasts. As the baby matures, his breastfeeding skills will improve. His sucks will become long, strong, and regular, and his jaw will drop low as he swallows. The baby will learn to take rest breaks and pace himself. It's important for the mother to build up a generous supply of milk. The flow of milk will be easier for the small baby to access. After her baby feeds, advise the mother to express her milk to keep her supply up. Her breast should feel soft when she's removed enough milk. Gradually increase breastfeeding with less and less supplementation. As a guide, if the baby does not attach well at the breast, give him a full feed by feeding tube or cup. If he attaches well, but has frequent long pauses or feeds for less than 10 minutes, give half the feed by cup or feeding tube. If the baby feeds well by breast for more than 15 minutes, he does not need extra feeding. At this point, the mother can very gradually reduce the number of times she expresses. Make sure the baby's weight gain continues once he is only breastfeeding, that he's content after feeds, and that he has frequent yellow stools, 4 or more each day. Remember, feed the baby when he signals he's ready. Practice first on the breast, then give the remaining volume by cup or feeding tube. Gradually increase breastfeeding with less and less supplementation.